The heart for listening practice. The heart is an important organ of the human body that supplies oxygenated blood to the entire system. It pumps blood through the circulatory system. The pumping of the heart is called the heartbeat of the person. A normal heart rate for adults ranges from 60 to 100 beats per minute. Heart rate is checked by a pulse that you can feel by placing your index and third fingers on your wrist, neck, etc. You should count your pulse for 1 minute or count for 15 seconds and multiply by 4 to determine your heart rate. The most appropriate time to measure your heart rate is right after waking up. Heart rate. What is not normal? An abnormal heartbeat occurs when the heart beats either too fast or too slow. It can also beat irregularly without any set rhythm. These are called arrhythmias. Some common types of abnormal heart rates are tachycardia. Tachycardia, a medical condition where your heart beats faster than normal. Bradycardia. This is a condition in which the heart beats slower than normal. Tachybrady syndrome, sick sinus syndrome, leads to periods of very fast or slow heartbeats. Tachybrady syndrome. Atrial fibrillation is the most common irregular, usually rapid heart rhythm. Atrial fibrillation, also called atrial fib, is the rapid and irregular beating of the upper chambers of the heart, causing an irregular heart rhythm. Atrial flutter is usually a rapid heart rhythm where the atria contract at a much faster rate than the ventricles. This can cause the atria to beat very rapidly, sometimes up to 300 beats per minute. Heart blocks are caused by delays or interruptions in the conduction system between the upper and lower chambers of the heart, which can cause a slow heart rate. VFib or VF is an abnormal heart rhythm in which the ventricles of the heart are quivering and not contracting. Ventricular fibrillation results in cardiac arrest with loss of consciousness and no pulse. A premature atrial contraction, also called PAC, is when the atria contract early and is felt like the heart skipped a beat. What are their symptoms? When your heart rate is not normal, you may develop one, most, or all of the following symptoms: dizziness, irregular pulse, palpitations, sweating, chest pain, shortness of breath. The skin becomes pale. When to see a doctor for heart rate? You should see a doctor immediately if you feel dizzy or have trouble breathing. Review, record your answers. Be brief. What is tachycardia? What is bradycardia? What is atrial fibrillation? What is ventricular fibrillation? What is a pack? Good job. Keep practicing.